We got the idea to write a book about narcissism and its discontents because there is considerable difficulty among clinicians in trying to figure out who is really pathologically narcissistic and who has variations of normal or healthy narcissism, because everybody needs self-esteem. So we set out to define groups of people with narcissistic problems who required psychotherapy, other kinds of psychiatric interventions, and we took that as a starting point and learned that there are many different subtypes of people who are narcissistically hurting and need our help, and we figured we could write a book about therapy that would guide therapists who are looking at these kinds of problems.
We wanted it to be a really practical book, right, Glenn? That when we're thinking about people who have narcissistic problems, there are lots of people who are discontented. So the patients themselves are discontented and struggle with their self-esteem. Their mental health professionals are discontented because we don't know exactly what to characterize as healthy narcissism and what to characterize as pathological narcissism. We don't exactly know how to best treat it. Researchers are discontented by the difficulties with the diagnostic categories, and certainly patients and families and loved ones are also struggle when they're in relationships with people who are narcissistic.
One of the great tragedies is narcissistic people feel like they cannot get the love they need, the approval they need, the admiration, and they often go through their lives feeling, I'm not getting what I need. So there's a tragic element to it that we thought we could highlight by writing this book and helping people empathize with those who have narcissistic struggles.
The book really spends a lot of time talking about some of the clinical and diagnostic problems that we face as psychiatrists and psychotherapists dealing with people who are narcissistic, as well as tries to make some practical recommendations about strategies to treat people. I think one of the things we really want to emphasize is the necessity to tailor the treatment to the particular patient.